Hello, thanks for being here and welcome to this overview of the case management agency transition that Community Connections is going through. Hi, I'm your narrator. This is Tara Keene. I'm the president and CEO of Community Connections, and I have been working at Community Connections and with the Colorado system for case management for over 22 years. So we've seen a lot come and go in that time, and this is probably the most monumental transition we've been through during that time. So thought it would be helpful to put out some information because it is complex and does have a lot of moving pieces. So let's get going. So just wanted to start with a little context of Community Connections, who we are when we're starting this whole major transition. So Community Connections is a 501c3 nonprofit that has been operating in Archuleta, Dolores, La Plata, Montezuma, and San Juan counties of Southwest Colorado since 1985. So we've been very well established for 38 years. And during that time, our focus of programs has been on serving people with intellectual and developmental disabilities, including young children who are experiencing developmental delays. And then, of course, their families, caregivers, their systems of support as well. And we have done this as what is called a community-centered board, and we'll get to what that means in a moment. But essentially, we have done both the direct services of going out, supporting people in their homes, in their communities, providing personal care, homemaker, respite for people who are living in a family environment, help with grocery shopping, getting out into the community, accessing the activities people are interested in, finding jobs, keeping jobs long term. So lots of direct services that we have provided. Again, specifically focused on people with intellectual and developmental disabilities, or IDD. On the other hand, we have also provided the case management for those programs. So this involves intake, resource and referral, helping determine eligibility, helping people articulate or come up with their goals, what they want to accomplish, and then helping them choose and then authorize the services that they can receive to help meet those goals. So that's what we've been doing over the past 38 years. And we have done that within this Colorado system of long-term services and supports. The case management system for LTSS has been part of a greater program under the governor's office. The folks that we work with the most closely, the Department of Healthcare Policy and Financing, or HCPF, and they, among other things, manage Medicaid and Medicaid programs for the state of Colorado. Within that, their Office of Community Living is really focused on these community and long-term care services and supports, specifically for people who are Medicaid eligible and meet some other eligibility criteria as a person with a disability. So within that, we've had this kind of bifurcated, siloed system, kind of split in half. And if you'll look over on the right side, this is the community center boards that I mentioned Community Connections has been since 1985. And these were the 20 organizations across the state of Colorado who were managing those programs specifically, again, for people with intellectual and developmental disabilities. So there were a number of programs that community center boards have been providing, but all of those IDD related. And on the other side, over here on the left, the single entry point agencies we're providing case management for essentially all of the other programs for people with disabilities. So older adults, people with physical disabilities, sensory disabilities, major medical conditions that cause disabilities, mental health conditions. So pretty much everything else that was not intellectual and developmental disabilities. So what this meant is that we had our system split in two. And so um, basically based on someone's diagnosis, not necessarily the program that was most appropriate for them. And a lot of people, of course, are eligible for multiple kinds of programs. And so within this system, people would be shuffled around. Anytime someone changed programs, it was a huge transfer situation. And so it was a little clunky, but this was the system that we have had for decades. And this next slide just kind of breaks down into within those two categories, what have been the exact programs. And of course, these have changed and shifted over the decades as we've designed new, more effective programs, and others have sunsetted or gone away. So again, if you look at the Community Center Board list, with the exception of the Children's Home and Community-Based Waiver Program, these are all targeting kids and adults with IDD. And over on the single entry point, you can see some different disabilities listed. So elderly or older adults, people with vision impairments, disabled, mental health supports, brain injury. So all of these have been managed by the single entry point. So this is the system we've had in place, as I say, for decades. And then 2014 came along, and the Federal Centers for Medicare and Medicaid Services changed some rules. Now, you remember I mentioned that these programs were under the Medicaid Office of Colorado and are funded by Medicaid. So, of course, our federal partners who supply Medicaid funding also have some authority and accountability with the programs that we manage here in Colorado. So they came up with a rule in 2014 that said, hey, all you folks who are doing these direct home and community-based services, so all of that whole list that I showed you in the last slide, everyone who's doing direct services for the person, you really shouldn't be doing case management as well. And we think this is a conflict of interest. And states like Colorado, we were not the only ones. Those of you who are doing this system where you sometimes have both services within one organization, you've got to figure out something else. If you want to keep getting our money, you really need to redesign your system. So what's this conflict of interest they were talking about? Well, remember when I said that over the years, Community Connections has done both the direct services and the case management. Well, this has meant that there is a single organization that is both helping a person choose and authorize services, as well as provide those services. So there's the potential within that sort of system for organizations, for people working for those organizations to make decisions or to lead people to make decisions that are more for the benefit of the organization than for the person. So this creates a conflict of interest that, a person could be acting against the needs and the best wishes of the person that they are trying to serve. So this was one of the problems that the Federal Centers for Medicare and Medicaid Services was trying to fix with this new rule. So of course, Colorado looks at this new rule and says, oh, I guess we're going to have to make some changes because we no longer fit within what is allowable for these Medicaid dollars. And they looked back at that kind of siloed split system and said, as long as we're having to make big changes, why don't we see how we can actually improve the way case management services for people in these Medicaid programs operate? So this is a little complicated slide. I don't expect you to take it all in, but this was kind of the graphic that our state partners came up with to represent that vision that they had for this new system that would both meet that federal rule and try to improve the effectiveness of case management services across the state. So as you can see within this house, this is kind of a house model for case management agencies. Within this house, they are collapsing all of the case management services, everything that's been done by single entry points and community center boards, all within this same house. You'll see at the top here, it's kind of led by person-centeredness. So this is kind of the overarching goal of everything that's going on within the house is let's not be centered on what an organization needs, on what a system needs, on the way we've always done things. Let's really be centered and focused on each individual person we are serving and their preferences and their goals and their interests and the way they want their life to look. So all of these functions that are being assigned to the case management agency will be under that umbrella of person-centeredness. And then down here at the bottom, kind of the foundation is some standardization. So throughout the years, I said we had 20 community center boards, more than 20 single entry points, both within governmental entities and private case management. So well over 40 agencies that the state of Colorado was trying to manage providing case management. A lot to juggle, a lot of different agencies. And so within that, some potential and some actual inconsistency across the state. So part of this foundation is let's reduce the number of agencies that are out there. Let's set some really consistent standards for quality. And let's make sure everybody is trained to meet that quality. So that's kind of the foundation for all of the things going on above it is let's make sure that the case management we are providing in Colorado is the highest quality we can possibly manage. So within that case management agency, you can see I took out the single entry point and CCB, those go away, and all of these programs are within that same case management agency. So as a person changes, as they are choosing the program that best meets their needs, they can do it all within one agency. And then, of course, there are some additional services that case management agencies are or can be providing. That includes the state-funded programs that community center boards have traditionally offered, family support, state supported living services, OBRA supported living services, which are some extra services people can get in nursing homes. Early intervention and EI evaluations is not necessarily going with case management agencies, but at Community Connections, we are intending to continue early intervention with that case management piece. And then all of the administrative functions that case management agencies have done to support their functions and to offer some other levels of protection and input from people receiving services. So at Community Connections, of course, we're watching all of these changes happening. And so here's a little bit of our timeline and how this has impacted us and our community. So as I said earlier, we started in 1985, and at that time we were the Community Center Board for Archuleta, Dolores, La Plata, Montezuma, and San Juan counties. Again, doing all of those community-centered board, intellectual and developmental disability services. 2014, we get that federal rule change. And of course, the state of Colorado making major plans, lots of details, lots of work done to help develop a plan that gets us to that house that we just saw, that future view for or vision for case management. So then we had this interesting opportunity at Community Connections in 2020. Our community partner, San Juan Basin Public Health, needed to shift its single entry point to another organization. And we saw that as a great opportunity. We knew what was coming. We'd seen this vision for how case management would be in the future. And we thought, wow, this is a really interesting opportunity for us to try this out before the big change happens, um, especially being a rural community and knowing that we know there are times that things are designed that make sense in larger metropolitan areas on the Front Range in the Denver metro, and they just don't scale, they don't fit as well within a rural community. So we thought here, not only can we try this out, but also kind of be a pilot for the state and show others how this may or may not work in a rural environment. So we took on the single entry point for 3 of those 5 counties. So for Archuleta, La Plata, and San Juan counties. And overall, I think the response from both the staff who came over with that transition and our clients has been positive. Um, really putting those programs together under one house, under one umbrella, I think has been made a more simple, seamless entry and ability for people who are coming into services to have their full choice. um, Having the case management all be within an organization that is really focused on um, disability and disability advocacy has really given a new lens to how some of those single entry point services are offered. Also, really gave an opportunity for cross training and resource sharing between all of the case managers for all of these programs. So, we felt like it had been a very successful pilot or trial. And so when the time came and the state of Colorado said, okay, we're really making this move and we need to get it down to 20 case management agencies, we need people who are interested to submit proposals. Community Connections decided, we think this works. We think we can do it. So back in the winter of 2023, actually just before New Year's of January 2023, the state of Colorado put out its request for proposals for Colorado case management agencies. And they had divided the state into some geographic regions called designated service areas. And the service area for Southwest Colorado perfectly aligned with where we'd been serving as a community center board. So where we already had local connections and local resources. So it perfectly fit with our geographic region. It perfectly fit with our vision for what we felt like we could offer our communities as case management. So we submitted our request for proposals, spent a couple of months getting everything together, submitted our proposal, and in June of 2023, we received the notice that we were being awarded the contract. And then big shift, November 2023, November 1st, we take on this contract and we will be the single case management agency for Archuleta, Dolores, La Plata, Montezuma, and San Juan counties. So what does this mean? I think is the big question on many people's minds. So how will each person be impacted? So for everyone in Archuleta, La Plata, and San Juan counties who are receiving our case management, and that includes early intervention and family support, there's not going to be any change. You're going to see no change whatsoever at the level of the services we're providing. For everyone who is currently part of that case management community center board for people with intellectual and developmental disabilities in Dolores and Montezuma counties, again, including early intervention and family support, also no change. You will continue receiving your case management through Community Connections, probably retain your case manager, no changes. Where we start to see change is for all of the current single entry point participants who are served by Montezuma County Public Health, and this includes both Montezuma and Dolores counties. Case management for these programs will transfer to Community Connections on November 1st. People receiving services do not need to do anything. Your service plan will not change. Your service providers will not change. Nothing for you will change except that your case management will be managed through Community Connections instead of Montezuma County. Now, we've actually been really, really fortunate to be able to hire most of the case management team from Montezuma County. So in many cases, your case manager won't even change. So hopefully this will be as gentle a transition as possible for the people who are going to see this change. Now, there's another future change we also need to consider in this, because if you'll remember, part of this federal rule is if you're providing case management, you can't also provide direct services. So we are currently working to establish a new 501c3 nonprofit, and it's been named Our Own Lives. And that nonprofit is going to take over all of our direct services starting July 1st of 2024. So starting then, everyone who currently receives direct services for Community Connections, we will no longer be providing those services. So the option will be transfer over to Our Own Lives, where a lot of our staff and leadership will be transferring as well, or choose another provider that is approved by the state of Colorado to provide intellectual and developmental disability services. So we will have a lot more information about that transition as we get closer, but this is part of the impacts that are coming. So I wanted to make sure this was part of the picture we are building about this transition. So I almost hate to talk about the fact that this was driven by a federal rule change, because really Colorado has taken this opportunity to really improve the way case management happens in the state. So really what I want to emphasize are the huge benefits that we are going to see as communities, as people who are receiving case management services. So a few of these benefits that I think people will see is, of course, finally having conflict-free case management, both in Southwest Colorado and across the state. So no longer will there be even the perception or the possibility that your case manager will be acting more in the interest of an organization than in your interest. So that will be a huge change. As I said before, some of the benefits that we had already been seeing is having this single case management agency to streamline access. So as people move throughout the region, which we know people do a lot, not having to transfer to another agency when someone moves from Durango to Mancos, for example. It will all be within the same agency, fairly seamless process just to move within our little region. And then something that I'm very excited about is that focus on case management for people with disabilities and older adults. And I think this comes in two parts. One being with the change of direct services going to Our Own Lives, Community Connections really being able to focus on case management and what the best practices and emerging practices are for case management. What are people with disabilities asking for, wanting in their case management? How can we make sure we are the most responsive and high quality case management agency we can possibly be? But also focusing just on people with disabilities, that these programs will not be lost in larger organizations that have many, many different programs, many different things that they are trying to juggle. At Community Connections, our focus will be as a disability organization and as an advocacy organization for people with disabilities. So I think that will really benefit people who are receiving services and our communities as we can really develop ourselves as this resource. So some folks are probably wondering, okay, we're making this change. Where can I find my case manager? So all of the Montezuma and Dolores case management staff are moving to our Community Connections office in Cortez, which is located at 105 South Harrison. That's just about a block away from City Market, about a block south. We already have contact information for all of the case managers who are going to be working in Montezuma and Dolores County. Some transferring over from Montezuma County Public Health and a couple new to the community. So all of this information is on our website. You don't have to scribble all this down. You can check our website at communityconnectionsco.org, and you'll have you'll have this slideshow and all of our contact information there. So next steps, we've talked a lot about where we've been, where are we going, what happens now? So on November 1st, we will flip that switch and Dolores and Montezuma counties will transition over to Community Connections. And then over the next few months for the rest of our fiscal year, November 2023 and June 2024, we're going to be really focusing on rebranding and strategic planning. With this transition, Community Connections is really shifting to a different organization with a different focus, different scope of who we are serving. It's not just people with intellectual and developmental disabilities anymore. So really trying to figure out, how do we tell that story of the new Community Connections? What are we going to be when we grow up? And so really working to dig in and figure out, what this shift means and what will look like in the future. At the same time, we are really focused on recruiting a new or more representatives to our board of directors and our community advisory committee. Our current Community Connections board of directors is splitting into two. They've already started deciding, some are staying with Community Connections, some are going with Our Own Lives. And so we really need to recruit more board members for both to have good, strong, sustainable boards for both organizations. So Community Connections is really focused on adding more members to that bench and really focused on ensuring that we have great representation, both on our board of directors and community advisory committee, both geographically, making sure that we are really hearing voices from across our region, and ensuring that people with disabilities and their families have a really strong voice and presence within our leadership. So really active recruiting, especially again, from the people that we're serving. And then of course, our final major transition, we flipped the switch again on July 1st of 2024, when all of our direct services will transfer over to Our Own Lives. Community Connections will stop providing those direct services, and Our Own Lives will be up and functioning and completely separate from Community Connections and our case management arm. So here's some contact information and also some other great resources that you can check out. Please, there's no question that's too small, that's silly. All questions are great and sometimes help us reconsider things that we are doing. This is a lot of newness, big changes. And so ideas, thoughts, feedback are really helpful as we continue this process of developing who we're going to be as the case management agency for Southwest Colorado. So thank you so much for making it to the end of this video. I really appreciate your interest in what's going on and hope you will stay involved, stay informed, tell your friends. This is a really complicated change and the communication is really important to make sure that people still know where to find us, how to get what they need within our region. So, thank you so much for your time, and we hope to see you around.